Welcome to our deep dive on peptic ulcers.
We're going to be focusing on giving you a clear, easy to understand explanation of this common condition.
Yeah, it's like a personalized guide to understanding what's going on in your digestive system.
We'll be using information from trusted sources like the National Institute of Diabetes and Digestive and Kidney Diseases.
So you know you're getting accurate and reliable information.
Right.
Perfect. Now, when we talk about peptic ulcers, what are we actually talking about?
Think of them like little sores, but instead of being on your skin, they develop on the inside of your stomach or the upper part of your small intestine, an area called the duodenum.
Okay, that makes sense. So what causes these sores to form? I've always heard stress and spicy food are the main culprits. But is that true?
Well, that's a common misconception. While stress can play a role, the real troublemakers are often a bacterial infection caused by something called H. pylori and the use of certain pain relievers known as NSAIDs.
NSAIDs, those are pretty common, right? Lots of people take them for headaches and aches and pains.
Yeah. Exactly, things like ibuprofen and aspirin are NSAIDs. They work wonders for pain relief, but they can sometimes irritate the lining of your stomach, making it more vulnerable to ulcers.
And what about this H. pylori bacteria? What makes it so troublesome?
This tiny bacteria has a knack for surviving in the harsh environment of your stomach.
Really?
It can burrow into the protective lining, causing inflammation and eventually leading to those open sores we call ulcers.
So if I'm getting this right, it's not the spicy food itself that causes the ulcer, but rather these other factors that weaken the stomach's defenses.
You had it. Spicy food might aggravate an existing ulcer, but it doesn't actually cause them.
Hmm,
It's more about those underlying issues like the bacterial infection or the use of NSAIDs.
that's good to know. It's always helpful to separate fact from fiction when it comes to our health.
Absolutely.
Now, you mentioned that H. pylori infection is one of the main causes of ulcers. What's interesting is that the older we get, the more likely we are to have this infection. Why is that?
Well, the exact reason isn't completely clear, but it could be due to a combination of factors. As we age, our immune systems might not be as strong, making us more susceptible to infection. Plus, H. pylori is often spread through contaminated food and water, so over a lifetime, the chances of exposure increase.
That makes a lot of sense. So let's say someone suspects they might have an ulcer. What kind of symptoms should they be looking out for?
The most classic symptom is a burning pain in the upper abdomen, sort of like a really bad heartburn. This pain can be quite sneaky. It might show up when your stomach is empty, wake you up at night, or even appear a few hours after a meal.
So it's not always a simple case of I ate something bad and now my stomach hurts. The timing of the pain can be a clue, right?
Absolutely. It's about recognizing the patterns. Along with that burning pain, you might also experience indigestion, nausea, vomiting, or even a loss of appetite and unexplained weight loss. But sometimes, and this is really important, some people don't have any noticeable symptoms at all.
That's scary.
Yeah.
So how would you know if something is wrong if you don't feel anything?
That's why regular checkups with your doctor are so crucial. They can screen for potential problems even before symptoms arise. But if you're experiencing severe pain, dizziness, or notice any unusual changes in your bowel movements like black or tarry stools, that's a sign to see a doctor right away. Don't wait.
Okay, let's talk about how doctors actually figure out if someone has an ulcer. It sounds like they have to play detective a bit, right?
You could say that it starts with a thorough medical history. Your doctor will want to know about your symptoms, any previous ulcers medications you're taking, even if there's a family history of ulcers or stomach problems. It's like gathering clues to understand the full picture.
So the doctor's taking notes, asking questions. What's next? Do they break out the magnifying glass?
Well, maybe not a magnifying glass, but they'll definitely conduct a physical exam. They'll feel your abdomen to check for any swelling or tenderness, and they'll listen to your stomach with a stethoscope to hear how things are sounding in there.
And I'm guessing medical tests come into play as well.
Absolutely. Tests can help confirm the diagnosis and rule out other conditions that might be causing similar symptoms.
So what are some of the tests doctors use to get to the bottom of things? Are there any other tests they might use?
There's also a stool test that can look for signs of H. pylori. But the most definitive way to diagnose an ulcer is with a procedure called an upper endoscopy.
Okay, that one sounds a bit more serious. What exactly happens during an upper endoscopy?
It might sound scary, but it's really not bad. You'll get some medication to help you relax. Then the doctor uses a thin, flexible tube with a tiny camera on the end called an endoscope to look directly at the lining of your stomach and duodenum. They can even take a small tissue sample called a biopsy to examine under a microscope if needed.
Wow, that's amazing. They can actually see the ulcer right there on the screen. What about x-rays? Are those ever used to diagnose ulcers?
Sometimes a test called an upper GI series involves drinking a barium milkshake. This barium makes your digestive tract show up clearly on X-rays, allowing the doctor to see if there are any ulcers or other abnormalities.
It's like giving your stomach a temporary highlight for the X-ray camera. So once the doctor has gathered all the clues and figured out that you do indeed have a peptic ulcer, what's the next step? How are they treated?
The good news is that peptic ulcers are usually very treatable.
Oh, good.
Just like we talked about two main causes, H. pylori and NSAIs, we have two main approaches to treatment.
Okay, let's dive into those approaches. What's the game plan if the ulcer is caused by H. pylori?
If it's a bacterial infection causing the trouble, the focus is on getting rid of those pesky H. pylori bacteria. Doctors usually prescribe a combination of antibiotics, which you'll need to take for a week or two to completely clear the infection.
And what about ulcers caused by NSAIDs? Is it a completely different approach?
If NSAIDs are the culprit, the main goal is to reduce the amount of acid in your stomach. There are several effective medications that can do just that.
So walk us through those medications. What are they and how do they work?
One of the most common types are called proton pump inhibitors, or PPIs for short. They're really good at blocking the production of stomach acid. Another option is H2 blockers, which work in a slightly different way to also reduce acid levels.
This is a helpful detail for you. Research has shown that a longer course of antibiotics, about 14 days, is often more effective for eradicating H. pylori than a shorter course. So it's really important to follow your doctor's instructions carefully and complete the full course of treatment, even if you start feeling better sooner.
That's crucial. And your doctor might also recommend other medications to help manage symptoms and protect your stomach lining while it heals, like antacids to neutralize acid, or medications that coat the stomach lining and create a protective barrier.
It's like giving your stomach a little extra TLC while it recovers. And speaking of recovery, what happens if someone needs to keep taking NSAIDs, even though they're causing ulcers? Is there a way to protect the stomach in those cases?
Absolutely. Your doctor can help you find ways to minimize the risk. They might recommend taking the NSAA with food, adjusting the dosage, or prescribing a medication specifically designed to protect your stomach lining while you're on the NSAID.
That's reassuring to know. It seems like there are lots of options to address different situations. But even with treatment, I imagine there can still be complications sometimes.
You're right. While most people respond very well to treatment, it's important to be aware of potential complications, so you can seek medical attention promptly if needed.
So let's talk about those potential complications. What are some things to watch out for?
One possibility is a bleeding ulcer, where the sore in your stomach or duodenum starts to bleed. You might notice signs like blood in your vomit or black tarry stools. Another complication is perforation, where a hole develops in the stomach or duodenum. This is a serious situation that usually requires surgery to repair the hole.
And what about obstruction? What causes that to happen?
Obstruction occurs when the ulcer creates a blockage in your digestive tract, making it difficult for food to pass through. This can cause symptoms like nausea, vomiting, and abdominal pain.
Here's something important to remember. In rare cases, gastric ulcers, which are the ulcers located in the stomach, can be linked to an increased risk of gastric cancer. That's why it's so important to follow up with your doctor for any ulcers that don't seem to be healing properly, or if you experience any new or worsening symptoms.
Exactly. Regular checkups and open communication with your doctor are key to managing ulcers and preventing potential complications.
This has been incredibly informative. It's amazing how much we've learned about the causes, symptoms, diagnosis, and treatment of peptic ulcers. It really highlights how important it is to seek medical advice if you're experiencing any digestive issues.
I agree. Self-diagnosing can be risky, and it's always best to rely on the expertise of a healthcare professional. They can help you get the right diagnosis and create a personalized treatment plan that's right for you.
What's the key takeaway you want listeners to remember from this deep dive?
I think the most important message is that knowledge is power. By understanding how peptic ulcers develop, recognizing the symptoms, and knowing the treatment options, you can take charge of your digestive health and work with your doctor to get the care you need.
And if you suspect you might have an ulcer or any other digestive issue, don't hesitate to reach out to your doctor. Early detection and treatment are key.
Exactly. Your doctor can provide personalized guidance and support to help you navigate your health journey. And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, it's all there.
So big thanks to them for all the great work they do.
Yes, thank you.
Well, thank you for joining us on this deep dive into the world of peptic ulcers. We hope you found it insightful and empowering. That's it for today's episode. We'll catch you next time for another deep dive into a fascinating health topic.